You are listening to High Heels and High Chairs, voted the best online resource for busy moms who wish to stay strong, sexy, and centered in a world of spit up and sippy cups. Whether you're a new mom, a grandmom, a future mom, or somewhere in between, you'll love these priceless tips, tricks, and tools you will learn today. Here is your host, top female fat loss and hormone specialist, Dr. Michelle Sands.
Hi, and welcome back to High Heels and High Chairs, where we are discussing how to stay strong, sexy, and centered in a world of spit-up and sippy cups. I'm your host, Dr. Michelle Sands, and today we have with us someone very special. I have been an admirer of this woman for many, many years, back to my days in medical school. She is not only a medical doctor, but she's also a naturopath, a herbalist, an acupuncturist, a nutritionist, an author of over 30 books. She does lectures around the world. You may have seen her on TV, and she is just an amazingly insightful woman and really a warrior for women's health. So I want to welcome to the summit Dr. Carolyn Dean. Carolyn, thank you so much for being here.
Oh, thank you, Michelle. Great to be here, especially with your audience, which are women who are keeping the gene pool going, which is something that I gave up on long ago. I only had foster children, so I so admire professional women, especially, who are also mothers. So just ask me anything, Michelle.
Wonderful. Well, thank you so much. So I'd love for you to, I know so much about you because I am just like, I'm a huge admirer. And I'd love for you just to share a little bit with the audience of your background and maybe why you decided to not only be a medical doctor, but also a naturopathic doctor, an herbalist, nutritionist, all those things as well, and then how you use all of that knowledge to help people improve their health and really optimize their life. So if you can just give us a little background on yourself in that area.
Oh, sure. I'd love to. Yes, when I was in my teens, actually, my husband and I, well, we weren't married then. We ran away from home, and I began instead of getting into the hippie dope movement, I actually got into the health movement out in California. And I just get so excited about vitamins and nutrition. And back then, you could read all the books there were on health and nutrition. It's not like that anymore. But
right.
when we came home, I started, mouthing off to people, oh, you should do this or that. And, of course, they wouldn't listen to me. And I was just so motivated that I finally decided, well, I'm just going to go to medical school and be a doctor, and then they'll have to listen to me. And I chose medicine because back in the early 70s up in Canada, there were no naturopathic schools. So it wasn't until after my graduation from medicine, I was in my internship, that I started doing naturopathic training with the first school up in Canada. So it was very much focused in wanting to help people with their lifestyle nutrition, and thank goodness medical school did not deter me. I saw how crazy making medicine is and was, because they're just focused on finding disease symptoms and matching drugs to those diseases. And there was no talk about nutrition, maybe, half an hour about diabetes, where we were just told to send people to the dietitian. And even though in biochemistry, we had 200 hours of biochemistry, so, up on the slideshows, we'd see the biochemistry of like the Krebs cycle that makes energy, ATP, adenosine triphosphate. Well, come to find out that in the Krebs cycle, 6 of the 8 steps require magnesium. So if you don't have energy, it's usually because you don't have enough magnesium. But what medicine did, instead of, taking the clinical aspect of that biochemistry, they would just say, oh, well, usually this woman is depressed or tired or anxious or not sleeping, so let's give her a drug instead of giving her magnesium. So everything I learned in medicine, as I applied to what I had already read in all these health and nutrition books, I realized that they were totally missing the boat, and that's why I've become such a huge advocate of natural medicine and a good diet and then especially magnesium, because now we're realizing that the soil doesn't have enough minerals, especially magnesium. So even if you follow a high green diet or even drink 140 ounces of green drinks a day, you can still be magnesium deficient. So it all, really helped me to be prepared for what people are going through today. And no matter how much you try to eat a good diet and exercise and do all the rest of it, if you don't take good supplemental minerals, then you're still going to be deficient and suffer a lot of symptoms.
Wow, yeah, that's so powerful. And that's actually why I found out about you in the first place. I read one of your books on magnesium, and that was at a time when I was, just learning my naturopathic medicine practice, and it wasn't really talked about as much. So you were kind of like the gateway for me to learn more about magnesium and its effects on so many areas of the body. And the reason why we're doing this summit is because moms just give so much. Like, we do so much work in raising our children, nurturing, disciplining, exercising so much patience, and then the physical work that we do to prepare for pregnancy, building the life inside of us, and then getting out into the world and really, being there for our families. It really takes a toll on our bodies. And, as women, we have our menstrual cycles where our hormones go up and down, and, pregnancy takes a toll, and even menopause later in life. And these are all things that are really related, very much so, to our magnesium levels and mineral levels in our body. And that is not really talked about. Like you said, there's a lot of times women will go to the doctor for some issue, and they'll end up with walking out with an antidepressant, and they didn't know they were depressed.
Right.
So I love to have you talk about how magnesium plays a role. Well, first let's talk about PMS and the menstrual cycle, and how magnesium plays a role in the monthly cycle when it comes to the elevation and dropping levels of progesterone and estrogen specifically, and then why women might need more during those times.
Yes, I talk about that, and you're probably referring to the Magnesium Miracle book, where I try to explain the various layers of why women need more magnesium. And I think it's possibly because we do make more hormones, and we need magnesium just to make anything in the body. I mean, magnesium is necessary for 700 to 800 different enzyme processes in the body. So it's always working. And what happens with the hormones is when the hormones become elevated before the period, and then they'll drop down to create the period. So that's the cycling up and down, up and down. So when you're making those extra hormones, you're using more magnesium. So it's really common that the magnesium levels are low just before the period, and the lower they are, then the more PMS and the more dysmenorrhea or painful periods. So it's really incredible how you can give someone extra supplemental magnesium 2 weeks before the period and find that those symptoms go away. Now, I also add vitamin B6, especially the methylated forms of the B vitamins I work with. Actually, I have my own formula for that. And the B6 and the magnesium together really help attenuate those symptoms. So it's basically supply and demand, Michelle. You don't have enough supply, your body's demanding it. And then what happens is, in order to keep you going and, dealing with the family and your job and the baby and everything, you rev yourself up. You overstimulate yourself. You push yourself maybe with coffee or sugar, or you do something that creates more adrenaline. And adrenaline in the body, I call it an unstable accelerant. And I say it's like you're all revved up with nowhere to go. So you're pushing your adrenaline, and then that actually ends up causing things that you don't expect, or you don't even attribute to pushing yourself. Your heart is racing. Your brain is racing. And your heart can race at inappropriate times, like you can be driving to the nursery or something. You can be driving across a bridge and have what you think is a panic attack. But what's happened, you've had coffee for breakfast just to get you going, and you're hypoglycemic, and the caffeine is pushing your adrenaline. And all that constantly over time drains your magnesium and drains your adrenal glands. So then, you can go to a naturopath like yourself, Michelle, and you can find yourself diagnosed with, you have adrenal fatigue, and your thyroid is depleted, and you need thyroid hormone replacement. No, we're not going to give you those thyroid drugs. We're going to give you a natural thyroid hormone replacement. So you've jumped right into what I call green allopathic medicine, where instead of supporting your adrenal glands with magnesium and sodium, with sea salt in your drinking water, and instead of replacing your thyroid hormones with the building blocks, which are 9 different minerals that you need, then you jump into these desiccated adrenal, desiccated thyroid, and you miss the whole opportunities to support the body with minerals.
Yeah, I totally agree. It's really no different when natural practitioners just, dole out the drugs or the supplements, not the drugs, but not getting to why is that happening. And that's what I try to do in my practices, is figure out what is causing that and what's causing that thing to happen, and finally drill down. And it usually does have to do with the vitamin and mineral levels. Because, like you said, magnesium supports so many processes in the body, even for your monthly cramps and headaches and muscle spasms. I mean, magnesium is necessary for muscles to relax after a contraction. So if you don't have proper magnesium, you can be cramped up or have a headache. And that's just something that you don't really think of. You reach for the Midol, maybe, and when you get the cramps, right? And that's going to take care of it, but that's not really telling you why. So it's really interesting to hear that, taking certain supplements 2 weeks before can actually, free you from experiencing those unpleasant monthly symptoms. You don't have to have that curse that comes every, 4 weeks.
Exactly.
So that's amazing.
Yeah, but then, I say that in terms of experimental, but I'm telling women to take magnesium every day, because just like you say, it can help from head to toe with headaches, even migraine headaches, with esophageal spasms, where the food catches in their throat, or they have, trouble swallowing, and you get nervous and your throat closes up. That's all magnesium deficiency. I think the one way to look at magnesium deficiency is anything that affects the muscles or nerves, because magnesium relaxes the muscles and nerves, whereas the complementary mineral calcium tightens muscles and fires off the nerves. And you need both, of course. But what's happened in our world, and in pregnancy, this, you're told to take tons and tons and tons of calcium. You have to keep your bones strong. You have to build the baby's bones. But magnesium falls right off the radar, and you end up over-calcified, tight, tight as a drum. You have to relax to birth the baby. All your ligaments and tendons have to relax, but how are they going to do that when they're all tightened up with calcium? So magnesium is so essential to help the relaxing part of any muscle activity. So you look at anything that causes tightening, even acid reflux, that can be the stomach sort of going into a spasm and pushing stuff up your esophagus, the heartburn, or, adrenal fatigue we've mentioned, angina, heart pain, anxiety, atrial fibrillation, high blood pressure, calcium deposits in the arteries, cholesterol, constipation, depression, diabetes, the type 2, fibromyalgia, we've mentioned headaches, heart attacks, IBS, any sort of inflammation, insomnia, kidney stones, migraines, we've mentioned, muscle spasms, nerve twitches, PMS is on my list, seizures, and then there's sports injuries. How many athletes do you know that they'll get an injury and they just won't heal, and you think, well, they're supposed to be the healthiest people on the planet. Well, what they're doing is they're sweating out their minerals, especially magnesium, and they're ending up with, huge muscle spasms, atrial fibrillation, panic attacks, and it's crazy. I talked to some of these mid-20s, 30-year-old super athletes in the NFL, basketball, whatever, and they are so embarrassed because they're having panic attacks and they're having atrial fibrillation. And what's the treatment? They're told to go in for ablation, surgical procedures to kill the part of their heart that's creating these twitches and spasms and irregular beat, whereas the highest amount of magnesium in the whole body is in the heart. So the heart muscle needs to relax in between the contractions. So it's pretty crazy. And I know you'll ask this, probably your next question is, why do doctors miss all this? And it's because they think magnesium is a laxative, because the one they know about mostly is a magnesium oxide, which is only 4% absorbed. So they give people...
Yeah, that was actually my next question.
Exactly.
It's twofold. It's twofold. It's like, so I know women listening are thinking, okay, how can I get my magnesium? And the first you think about foods. I was going to ask you which foods have magnesium or high levels of magnesium that people can get from their food, but then also why supplementation is so important, even if you are eating those foods. And then on top of that, which form? There's a few different forms that are popular in the marketplace, and which form should we look for?
Well, food sources of magnesium, you can find lists, and I have that in my Magnesium Miracle book. They're whole grains, nuts, green leafy vegetables, pumpkin seeds, spinach, Swiss chard, those nuts, and just about any nut or seed. Seaweed is high. Cacao is high. I get people to mix up a tablespoon of cacao, a few tablespoons of coconut oil, maybe a tiny bit of stevia, and you can mix that up and roll pieces of frozen banana in it for an incredible, very healthy magnesium dessert. But with the food, I've already mentioned that the soil has to have magnesium in it, or it's not going to get into the food. 100 years ago, we could get 500 milligrams from our food. Now we're lucky to get 200 milligrams. And with all the stress and everything, I think people need more like, 800-900 milligrams of magnesium, elemental magnesium. And I quickly mentioned earlier about people on their 140 ounces of green drink. They still come to me with heart palpitations and leg cramps. And they say, that's not possible. I'm drinking all this green. And they'll do magnesium red blood cell tests to check their levels, and they're low. Because if the farmer, even if it's organic, if the farmer does not put magnesium and the other minerals in the soil, they're just not going to be taken up into the food. And that's it, bottom line. If it's not in the soil, it's not in the food. So, I really appreciate all the people going into raw food diets and their green smoothies and everything. It's really wonderful, but check the soil. So anyway, it is important to supplement, and then yes, the next thing your doctor and a lot of practitioners is going to advise is magnesium oxide. Most of the original magnesium studies were done with magnesium oxide, and it's only 4% absorbed into the bloodstream. That means 96% of it flushes out into the intestines as diarrhea. And that's okay for the, sort of okay for people who are constipated, but then you're just using it as a laxative. What you want is 100% absorption. And from my personal experience, I used to have heart palpitations and leg cramps, but then my other problem was any form of magnesium I took, citrate, glycinate, chelated, you name it, one pill, I'd get diarrhea. So I could never treat my symptoms. And for 10 years, I tried to get mineral companies to research and make a non-laxative magnesium, and they said, no, too expensive. No, it takes too much education to tell people the difference. And so finally I created my own magnesium, and I've been working with it now for about 3-4 years. It's called REMAG, REMAG. And it is 100% absorbed at the cellular level, has no laxative effect, and it's gotten to the point where people are getting off intravenous magnesium they've been forced to take because of the diarrhea, the laxative effect from magnesium to treat their magnesium deficiency. And people have been treating their atrial fibrillation, getting off their 6 or 8 different heart drugs for an atrial fibrillation, which for the most part may be just a magnesium deficiency, not a heart disease at all. And your audience may be too young for this, but the older you get and the more magnesium deficient you become, the more affected your heart will be.
Mm-hmm. Yeah, that's huge, and I have to give you props because I used to deal with really bad menstrual cramps, and I was on the birth control pill since age 12 because of that. And as I got more educated, I realized I didn't want to be on the birth control pill, but I was taking magnesium as much as I could take of a magnesium, like you said, oxide, and I was, of course, getting diarrhea if I took too much. So I was never able to get the relief from magnesium supplementation before I started using your product. And it's phenomenal in the fact that, I can take the right amount and I don't have to have bad side effects. And it really does help with the cramps from menstruation. Also, I am a triathlete, so after hard races, it really, really helps.
Oh, wow. Well, yeah, you're the perfect example then. And the thing about taking magnesium oxide for your cramping and everything, what happens with a lot of women during their menses is you get diarrhea.
Yeah.
You're constipated beforehand, and then everything lets go. And here you already have diarrhea. You're taking magnesium oxide, and you get more diarrhea. And actually, you can get depleted if you keep on having diarrhea and end up having more.
Right. That was the next thing I would say. You're not only losing the magnesium, but you're also losing other minerals and water, that you need desperately to be healthy. And so, it's really a double-edged sword there for a lot of people if they're just using what's on the store shelf.
Right. And mentioning water makes me think of what I also tell my clients and customers is that because we're so careful about our water now and we filter it and trying to get rid of the chlorine, fluoride, then the filtration is taking minerals out. And a lot, if you use reverse osmosis water, if you drink bottled water, most of it is distilled. So we're not getting the minerals we should be getting, from good mountain streams. So I tell people to put sea salt in their drinking water. But first of all, the amount is important, and the guideline I use is take half your body weight and use that number of ounces of water a day. So if you're 150 pounds, that's 75 ounces. And then in each liter of water, I put a quarter teaspoon of sea salt. And I'll use a quarter teaspoon in 16 ounces because I really love my sea salt. But most people say to me they They stop urinating so much when they drink sea salt water. And why is that? It's because the minerals are so much needed in the cells that the minerals just go to the cells. And in the cells, they pull water in after them because the water is mandatory in order to work biochemistry in the cells. So, you've got your Remag that goes right into the cells. It's just sucked up 100% into the cells. You got your sea salt, and then my other mineral is a multiple mineral called Remite, Remyte. Now that's important, especially for mothers, because your thyroid gland is really stressed during pregnancy, and that's why your doctor will test thyroid hormone levels when you're pregnant, but they won't do anything until your thyroid is so beat up and so low, and then they'll give you thyroid hormone replacement like we talked about earlier.
Right.
But instead, I make sure everybody, well, of all ages, is taking a teaspoon and a half a day of Remite, and that's got 12 minerals. 9 of them are necessary for the thyroid. Now, the most we've gotten to in medicine is that you may need iodine for your thyroid. In natural medicine, we've got to iodine and selenium, and maybe people know about zinc. But there are 9 minerals, including magnesium, that's necessary for the thyroid. So that's what, everybody should know. I mean, personally, I come from a family with low thyroid, so I was on my Armour thyroid for years. And 2 months into taking my Remite, when I was in the research stages, within 2 months, I felt a little speedier than normal, and then I took my pulse. It was a little elevated, and I thought I'm a little hyper. And I realized I had too much thyroid going. I realized my thyroid had perked up and said, hey, I've got my minerals. I can make my own hormones. So I should have weaned off, but I was so excited. I just quit my 60 milligrams of thyroid. It's like, don't do this at home, folks. Just wean off. And it's the thing, too, Michelle, about minerals, the Remite, Remag, the sea salt. Don't stop your drugs or your medications or even your supplements. If you're feeling lousy on what you're on, then use that as a guide when you start something new. And I tell people, if you start the sea salt, Remag, and Remite, then within a couple of weeks, certainly a couple of months, you'll feel so much better that you'll naturally want to wean yourself off your excess supplements or your medications with the help of your doctor. So it's really giving yourself the basic building blocks that nobody talks about. I mean, as you even mentioned, Michelle, when you go to a naturopathic doctor, they'll look at your symptoms and start matching supplements to your symptoms, rather than what we learned in naturopathic training was the 7 principles of learning that the healing power of nature, identify and treat the cause, first do no harm, doctor is teacher, treat the whole person, and prevention, and the hierarchy of therapeutics, where the therapy in the body will mean that the body starts healing at a certain level, but then symptoms may come to the surface that say the body's ready to treat the next thing. And what happens in my practice and with my customers, it's once their thyroid is working, adrenals, we're talking about the minerals and a little bit of my methylated B vitamin with a couple of amino acids that helps to detox the body. Well, the next thing that comes to the surface is yeast overgrowth.
Yes, I see a lot of that.
A lot of women have yeast, and it's another under-recognized, under-treated condition that really requires naturopathic medicine, because it's about the diet, it's about the lifestyle, it's about taking a probiotic, and something natural in the way of antifungals. You can with your diet, you can use your garlic and your natural antifungal foods, but you may also need a natural antifungal. So there are layers that we can work with when we're ready to, kind of observe them and not just try to suppress them with either drugs or supplements.
Right, and that's really my big message, at least to my patients and clients, is that the body does a phenomenal job of healing itself, but it needs the building blocks, and that's really what we have to focus on is those building blocks to support the body in healing itself instead of trying to throw something at you to, per se, heal you. The body has to heal itself, and I think that is really profound what you just said. And I love that the Remite has the 9 different minerals in it so that you don't have to take 9 different supplements, because that's one of the things that I was doing with my patients over the past few years is, they ended up needing, 12 different bottles 3 times a day to come out because they needed all of those things. So I love when I find formulas that are really highly absorbable and contain the right things, and Remite and Remag are really amazing products. So I'm really I can't thank you enough, and my patients can't thank you enough for being able to keep it simplistic and we're not going to have the side effects. And so I feel like I could talk to you for just a couple hours more, but we are trying to keep this unfortunately short because, audiences, we're busy moms. We want information quick, and we want it now. But you are really a great resource for this, so I want to make sure everyone heads over to your website and checks out all your great articles and your books and, of course, Remag and Remite. But before we go, I know you have a nice little free gift for everyone listening, so I want you to just explain what that is.
Yes, it's a 2-year online wellness program that I have, and the first 4 weeks are free, so people can see if that would be helpful to them. And because nobody can think 2 years ahead. What I've done as part of the free gift is if you want to buy the whole program, instead of paying $10 a month over 2 years, which is $240, you pay one-time payment of $150, and then I can give you the passwords to access all the modules, 104 modules at any time you want, instead of waiting for 2 years for the last module. And the other is 2 free books, one on Remag and one on Remite, that really explain the mineral dilemma that we're in now, and also discuss the Remag and Remite. And with the online wellness program, Michelle, I thought that would be it. I'd educate everybody, they'd understand, they'd go off and do their own research and, take different supplements. This is before I made the products. And it came at a time, the economy crashed in 2008, people got even more busy, and I just heard people screaming at me, I don't have time for 2 years of study, tell me what to take. And I
I get that a lot. Yeah, they're happy to know why and the how, but they just want to know the what a lot of times. And that's as moms, I understand it. You want to know what to do now, and then you'll do the research later. Yeah, and see if it works, and that's what's so amazing. That, like you said, I've been at this for 50 years. Since I was 16, I've been reading and just focusing, and everything about the Remite. I don't have too much copper in it because a lot of people are overloaded with copper, and everything I've got in there is tuned into what we've learned about minerals. But they're, instead of being 4 to 20% absorbed, they're 100% absorbed. So they work, and they're low potency. So if you show the bottle to your doctor, they'll say, oh, well, that's not too high. Whereas, what happened in natural medicine, and it's happening with doctors too, it's like, well, this isn't working, let's give more. Oh, these minerals, they don't seem to be working, let's do intravenous. And then all of a sudden it's like, oh, this person is calcified and they've got heavy metals, let's do IV chelation. So they're putting it in one end and taking it out the other. There's so much imbalance. It's crazy making. So I try to, just
get rid of the crazy and just give people, what works and what's assimilated.
Wow, so that's really amazing. I don't know if people caught that you have a 2-year program that was only $10 a month, and you're getting a discount on that, which is just ridiculously amazing because you have so much knowledge, and I can't believe that it's that low a price point. So that is just an awesome free gift. And then I love that you have a book on the Remite and the Remag so people can learn exactly why I love these products so much and why you took the time and the extreme effort to create these products because there's nothing like them on the marketplace. So I appreciate that. Thank you so much. I'll put the link to those free gifts next to this interview that you're listening to right now. So just go over and click. And then I'll also have a link to Dr. Carolyn's website so you can really dive into just her awesomeness and how much she just has a passion for helping people. And then you can also see great pictures of her working from her home in Maui, which she's just really made the lifestyle that she really wants it for herself, and she's trying to help you do that for yourself as well. So I love that. Thank you so much, Dr. Carolyn, for being here. I so appreciate your time and just everything you've done so far to really make it easier for me as a practitioner and for my patients to live the ultimate lifestyle that they want. So thank you so much.
Oh, thank you, Michelle. And I appreciate you and what you're doing and the fact that you're a working mom and out here trying to help everybody else. So mahalo to you.
Thank you. And thank you, everybody, for listening. Thanks, mamas, for taking the time out of your busy, busy day to really sit down with us and get educated and understand how you can build a better life for yourself and your family. So thank you so much. We will see you back here tomorrow, and have a beautiful day. Bye-bye.
Thank you so much for tuning in. I hope that you received a lot of value out of this interview. I know that I did. I want you to open up to the possibility of making this new year the greatest opportunity that you have had so far to improve your life. This is about breaking out of paradigms. It's about learning the art of living. It is about honoring who you are as a woman as you discover who you are as a mother. It is about taking care of your body, mind, and spirit so that you can take better care of your family and be a shining example, a role model for your children so that they can grow up to be healthy, happy, and successful. I promise to continue to bring you educational, empowering, and inspiring content to help you achieve the body that you dream about and the life that you are meant to live. Stay tuned for more value-packed interviews, and be sure to check out all the resources on my website, metabolicmama.com. Until next time, wishing you a happy, healthy, hot day. Take care, mamas.